Hello everyone, this presentation is on congestive heart failure. According to Iggy, patients over the age of 65 are hospitalized due to heart failure. This is also known as pump failure. Pump failure refers to the heart's inability to pump effectively. Most cases of heart failure typically start on the left ventricle. What does the body do to compensate for heart failure? The sympathetic nervous system gets stimulated. The renin-angiotensin system is activated. There are other chemical responses such as the release of BMP, and there is myocardial hypertrophy. In heart failure, the body compensates to improve cardiac output. Compensatory mechanisms initially increase cardiac output, but eventually damages the pump function. Sympathetic stimulation causes an increase in heart rate, increases stroke volume, and arterial vasoconstriction. An increase in heart rate increases cardiac output. However, there is a limitation on the rapid heart rate. Over time, the diastolic filling time becomes limited, thus cardiac output begins to decline. An increase in heart rate also causes an increase in oxygen demand. This occurs when there is tissue hypoxia. Sympathetic stimulation improves stroke volume by increasing venous return to the heart, which ends up stretching the myocardial fibers. The renin-angiotensin system becomes activated. Because of this, there is vasoconstriction, which also causes aldosterone to become secreted, and thus sodium and water retention. Preload and afterload will also increase. BMP is produced. Myocardial hypertrophy results from the demand to increase cardiac output. The heart muscle enlarges due to the compensatory mechanism to increase cardiac output. So this is a guideline set out by the American College of Cardiology and American Heart Association. It's evidence-based guidelines, and you could refer to your Iggy book for the guidelines for heart failure.
So what causes the congestive heart failure? The following conditions are known to damage or weaken the heart and can cause heart failure. Coronary artery disease is the most common cause of the heart failure. CAT results from the buildup of plaque in the arteries, reducing blood flow, which can lead to the heart attack. Hypertension can cause heart failure because the heart has to work harder to circulate the blood throughout the body. Over time, the heart muscle begins to stiffen or weaken due to extra exertion used to pump the blood efficiently. Another cause of the CHF is the faulty heart valves. When the valves in the heart are damaged due to a heart defects or heart infections, the heart is forced to work harder, causing it to weaken over time. Cardiomyopathy, myocarditis, congenital heart defects, and arrhythmias can all lead to the heart failure. Chronic diseases such as diabetes, hyperthyroidism, hemochromatosis, amyloidosis, and HIV can also contribute to the development of the heart disease. So, who is at risk? Certain populations have a higher risk for congestive heart failure than others. Men are more likely to experience heart failure than women. People who are 65 or older are the greater risk for it because the heart weakens with the age. Heart failure is more common in African Americans. Heart disease tends to run in families. A previous heart attack increases the risk. Obesity can lead to increased high cholesterol levels, high blood pressure, and diabetes. Smoking greatly increases the risk of heart diseases and peripheral vascular disease. Inactive lifestyle increases the risk of heart attack. Sleep apnea can cause low blood oxygen levels and increases the risk for arrhythmias, which can in turn weaken the heart. Alcohol and tobacco use can lead to weakening of the heart muscles. High blood pressure increases risk of heart disease, heart attack, and stroke. People with diabetes are 2 to 4 times more likely to develop heart problems.
So, the signs and symptoms of left-sided heart failure. Left-sided heart failure significantly reduces cardiac output. Because of this, pressure builds in the pulmonary venous system and results in pulmonary congestion, which may cause a patient to cough, have confusion, dyspnea, crackles, and tachypnea. If left-sided heart failure becomes severe enough, the patient may begin to have the frothy pink sputum as a result. This is a sign of life-threatening pulmonary edema. Reduced cardiac output and pulmonary congestion results in reduced oxygenated blood being dispersed throughout the body, causing pallor, fatigue, weakness, confusion, and cool extremities. So, the signs and symptoms of right-sided heart failure. In right-sided heart failure, systemic manifestations results causing fluid retention and pressure buildup in the venous system. When the right side of the heart is not pumping effectively, the blood coming back to the heart from the body becomes backed up because the right ventricle is not strong enough to push blood forward through the pulmonic valve to the lungs. As the severity increases, one may have edema that begins in the lower extremities that progresses to the abdomen. The liver congestion that results from right-sided heart failure can result in nausea, vomiting, and ascites. As blood backs up, jugular venous distension occurs and is manifested by a pulsation seen on the right side of the neck. How do we diagnose it? First, the nurse should collect a history. A nurse should assess the patient's medical history for diseases that can contribute to heart failure, such as hypertension, angina, myocardial infarction, and valvular disease. Next, the nurse should conduct a physical assessment. Assess for signs and symptoms of heart failure, such as weakness, fatigue, shortness of breath, edema, crackles in the lungs, tachypnea, and recent weight gain. Tests to diagnose heart failure include X-ray, electrocardiogram, and echocardiogram. Echocardiogram is considered the best tool in diagnosing heart failure and can also determine ejection fraction. In an X-ray, one will see hypertrophy of one or both of the heart ventricles. If both ventricles are enlarged, one may see a pleural effusion. Radionucleotide studies use thallium imaging to diagnose heart failure. In electrocardiograms, ventricular hypertrophy may be identified. Laboratory studies include ABGs, BNP, and electrolytes. ABGs often reveal hypoxemia due to alveoli being filled with fluid and reducing oxygen exchange. Respiratory alkalosis may occur first due to hyperventilation, then resulting in respiratory acidosis as a result of CO2 retention. The BNP levels may be elevated as the body's response to stretched heart muscle fibers and decreased cardiac output. Regular evaluation of electrolytes is important. Sodium, potassium, magnesium, calcium, and chloride irregularities may be caused from complications of heart failure or side effects of medications such as diuretics. The patient may have an elevated creatinine or BUN related to inadequate renal perfusion.
You can lower your odds of getting heart failure, and the earlier you start, the better your chances. You can begin with a few simple steps. Stick to a healthy weight, exercise regularly, eat fruits and vegetables, whole grains, and lean proteins. Limit your bad fats, added sugars, salt, and alcohol. Reduce your stress, get enough sleep, and don't smoke or use recreational drugs. In heart failure, nutrition therapy is aimed at reducing sodium and water retention to decrease the workload of the heart. Collaboration with the dietitian to help the patient select foods that meet the restricted diet is important. Fluid restriction of fluids must be watched by intake and output. Weigh the patient daily. 1 kilogram of weight gain is equal to 1 liter of fluid retained. So what can be done about CHF? It can be managed through lifestyle changes, heart medications, ACE inhibitors, beta blockers, diuretics, careful monitoring, and possibly getting an angioplasty. ACE inhibitors and beta blockers relax blood vessels and lower blood pressure and reduce the heart's workload. These drugs improve function and quality of life for patients with CHF. Diuretics are the first-line drug of choice in older adults with heart failure and fluid overload. These drugs enhance the renal excretion of sodium and water by reducing circulating blood volume, decreasing preload, and reducing systemic and pulmonary congestion. Maintain careful monitoring of the disease. Another option for the patient is to get a surgical procedure called coronary angioplasty to open blocked arteries and restore normal blood flow to the heart. This is performed in a cardiac cath laboratory. This procedure involves placing a catheter with a small balloon on its tip into the patient's narrowed artery. When properly positioned, the balloon is inflated and deflated, moving the plaque buildup further against the artery wall and thereby improving the flow of blood. Coronary angioplasty may be performed by stenting, a procedure in which a stent, which is an expandable wire mesh tube, is permanently inserted into the artery to keep it open and restore normal blood flow.
So discharge teaching. Remember the acronym MODS. Topics to include in discharge teaching include medication considerations, activity levels, daily weights, appropriate diet considerations, and when to notify the doctor about symptoms. The patient should know why they are taking their medications, the potential side effects, and that they should never let their supply run out. The patient should know their limits regarding activity levels, but try to stay active. Daily weights should be implemented to monitor for fluid retention. Sodium should be restricted to 2 to 3 grams a day, and fluid should be restricted to 2 liters daily. Lastly, if the patient is having any new or worsening symptoms, the patient needs to notify the physician immediately.
Question 1. A client with systolic dysfunction has an ejection fraction of 38%. The nurse assesses for which physiologic change? The answer is B. In systolic dysfunction, the ventricle is unable to contract with enough force to eject blood effectively during systole. As the ejection fraction decreases, tissue perfusion decreases, and the client develops activity intolerance.
Question 2. A client is admitted with early stage heart failure. Which assessment finding does a nurse expect? Answer C. In heart failure, stimulation represents the most immediate response. Adrenergic receptor stimulation causes an increase in heart rate and respiratory rate. Blood pressure will remain the same or will elevate slightly. Changes in creatinine occur when kidney damage has occurred, which is a later manifestation. Other later manifestations may include edema and lowered saturation readings.
Question 3. The nurse is assessing a client with left-sided heart failure. What conditions does the nurse assess for? The answer is A, B, E, and F. Left-sided heart failure occurs with a decrease in contractility of the heart or an increase in afterload. Most of the signs and symptoms will be noted in the respiratory system.
Thank you for listening.